A bump, lump, or knot on top of the foot is a common condition and one that is often painful. My name is Dr. Andrew Schneider and I'm a podiatrist in Houston, Texas. While on its own, the bump on top of your foot may not be painful. The problem is when you put on a pair of shoes. The pressure from the shoe causes pain. In today's video, I'm going to discuss how a bump on top of your foot is treated so you don't have anything left to interfere with your shoe. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. There are two main causes for a bump forming on top of your foot. One is a bone spur that causes a hard bump that forms on top of the foot. The other is a ganglion cyst, which forms as a bump that's softer and squishier. So here's the thing. There are many conditions that happen with our feet that can be caused by different things. In the case of someone with a hard, painful lump, it's a bone spur that forms in the middle of the foot. The soft bump is a ganglion cyst that forms in the tendon on top of the foot. Both make it difficult to wear shoes. Both are painful. Both can be successfully treated with a short outpatient surgery. A bone spur develops for a number of reasons, including faulty foot mechanics, an injury or trauma, and arthritis. The bone spur builds up over a joint and forms a point on top of the foot. This results in pressure and pain when you're wearing shoes. There are non-surgical ways to treat a bone spur. One way is to change the lacing pattern in your shoes to keep the pressure off of it. I recorded a video showing how to lace your shoes this way. I'll link to that video in the description. Sometimes a cortisone injection will manage the inflammation and pain. That said, the only way to remove a bone spur is with a surgical procedure. During the surgery, I shave down the prominent bone spur and make it flush with the rest of the bone. It's a pretty quick and minimally invasive surgery. Recovery from a procedure to remove the bone spur is pretty straightforward. You're able to bear weight immediately after the procedure while wearing a surgical shoe. You'll be able to get back into your regular shoes once the sutures are removed, usually in 2 to 3 weeks after the surgery. Once you're comfortable, you can resume activity. Like a bone spur, a ganglion cyst can also form because of trauma. The cyst forms in the tendon sheath on top of the foot. It's a soft tissue sac that fills with a thick, viscous fluid. The pressure on the cyst can also cause pain in shoes. There are also non-surgical treatments for a ganglion cyst. Like a bone spur, changing lacing patterns and a cortisone injection may be helpful. It's also possible to drain the cyst in the office. That works about 50% of the time. When it doesn't work, the cyst fills up with fluid again. It's then that we entertain surgery to remove the cyst. The recovery from surgery to remove a ganglion cyst is similar to the procedure to remove the bone spur. But because it's only involving soft tissue, there's even less swelling, and a full recovery is often quicker. When you get back into shoes after surgery to remove a bump, lump, or knot on top of your foot, your shoes will feel much more comfortable. It might be sore at first, but the pain should end up going away completely. While these are the most common reasons for a bump forming on top of your foot, they are far from the only causes. For instance, a gouty tophus can cause a painful lump to form. Inside a tophus is uric acid crystals. If you've had gout and formed a bump on top of your foot, this might be the cause. While less common, it's possible to get soft tissue tumors that form on top of your foot. These can be benign or even malignant. It's important to recognize that what you think is a simple ganglion cyst may end up being something more serious. For that reason, it's essential that you don't make assumptions as to what the cause of the bump on top of your foot is. It's worth getting it checked, just in case, to make sure it is what you think it is. Often I can tell with a physical examination and x-ray. Sometimes I'll use ultrasound, and I may send you for an MRI to make a proper diagnosis. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit the subscribe button so you won't miss another video. If you've been dealing with a bump, lump, or a knot on top of your foot, and it's become painful to wear shoes, don't wait. Come into the office and let's explore what the treatment options are to get you feeling better as quickly as possible. Thanks so much for watching, and have a great day.